Hello, my name is Joel Cook. I'm one of the nursing lecturers at North Metropolitan TAFE, and today I'll be demonstrating a subcutaneous injection. Knock knock. Hi Mrs. Clotter, how are you going? My name is Joel, I'm one of the nursing students here. I believe you're due for a medication. Yeah, can I just check your name tag real quick? Can you tell me your full name and date of birth, please? Great, and I'll check your URN. Perfect. And what are you allergic to, Josephine? Yep, that matches our records. Okay, so the medication you're due for is your heparin. So heparin is that injection you get on your belly to stop clots. Great, I'll get that for you now. Thank you. All right, we've arrived to the clean utility room and I've gathered my equipment to prepare for the administration of the medication. So the equipment that I've gathered is a kidney dish, heparin, medication, a 3 ml syringe, a filtered drawing up needle because we have a glass vial that we're drawing up from, a 25 gauge needle, which is what we use for subcutaneous injections. We have a alcohol swab, which we're simply going to use to break the vial. And we have, of course, our PPE. And finally, our medication documentation. So, Lisa, can you please check this medication with me?
Sure.
Okay. So, for Josephine Carlotta, we have heparin sodium, 5,000 units, 0.2 mils, and expiry is February 2025.
Yep.
We're going to give it via subcutaneous injection, and we're at the right time at the moment, and we have the right documentation.
Sure.
Anticoag chart.
Great.
Okay, all right. Happy for me to prepare?
Yes, thank you.
Okay. So, first thing is washing our hands. And donning our gloves. We'll grab our 3 ml syringe. And on our 3 ml syringe, we put on our filtered drawing up needle. Now remember to know your key sites and abide by ANTT. Next, we need to crack our glass vial, which might require a flick to get the fluid down to the bottom of the vial. And our alcohol wipe is put over it as such. Bend it back and crack it open. The lid goes in there. So now I'm going to draw up 0.2 mils as we calculated. And that glass vial goes in there so that we can check it later. So now that I've drawn up 0.2 mils, I remove the filtered drawing up needle, and now we put on our injecting needle. Again, be aware of the key sites. And prime this. Maybe you need a bit of a flick to get bubbles out from the bottom. And prime this to 0.2 mils. There we are. Okay, are you happy that that's 0.2 mils, Lisa?
Yep, happy with that.
Great, thank you. All right, and we are pretty much ready to go to the patient bedside and administer this medication. So, I grab my trolley. And of course, on my trolley, put my alcohol gel and my sharps too. Clean up our waste. And then we're good to go. Can we go to the bedside and do our next checks?
Sounds good.
Okay, thank you.
Let's go.
Hi, Mrs. Carlotta. How you going?
Hello.
We've got that medication here for you. Just need to check your ID band if that's okay. Okay, so we have Josephine Carlotta, date of birth 18th of the 5th, 1942. Urine is 965321. And what are you allergic to, Josephine? To morphine? Is that correct?
Yep.
Great. Cool. All right. Now, so we have heparin. Heparin, 5,000 units, 0.2 mils, expiry February 2025.
Sure.
And 0.2 mils, and we are subcutaneous route.
Yep.
And the right time at the moment, and we have the right documentation, being an anticoag chart.
Great.
Also to give. Thank you.
Yes.
Okay, Mrs. Carlotta. So, as you well know, this is the heparin injection that's going into your belly. Now, last night when they gave it, did they give it onto your left side or your right side? On your right side? Great. Okay, so we're going to give it on the left side this morning then. So I just need to pull this back if that's okay. All right. So, we're giving it into the abdomen, and we need to go either 5 centimeters left or right of the umbilicus, but as Josephine's just informed me, she had it on the right side, so we're going to alternate sides. And I'm going to go on the left side now. As I go on the left side, make sure it's not dirty, there's no bruising or scarring that I need to be worried about. And once I've had a visual inspection and it was okay, then I'm good to give the injection there. So, we take our needle, take off the cap, pinch the skin, and we'll be inserting 90 degrees directly down sharp scratch, Mrs. Carlotta. And then slowly plunge the needle, and then remove and cap, unpinch, and get rid of the sharps. And then we can apply gentle pressure with this gauze on the site of injection. All done, Mrs. Carlotta. Was that okay? All right, thank you very much. All right. So, if you get any, if you're feeling any signs or symptoms or anything you're concerned about, please feel free to press your call bell, which is right here. But otherwise, I'll be back to check up on you later. Okay, thank you. All right, shall we sign the document? Sign the medication chart? Great, thank you. And then can you please co-sign?
Yeah, sure.
Lisa? Great.
There you go.
Thank you very much.
Thank you.
So that is how to perform a subcutaneous injection. If you want to learn more, you can access your local policies and procedures, access your learning resources, or ask your lecturer. Thank you for watching.